Hello, welcome back to my channel Labor MCQ Bank Knowledge Booster. Today I am going to discuss about the drugs used in labor. So first of all, let me talk about the injection oxytocins. Injection oxytocin may be conveniently used in pregnancy, labor or puerperium. So here indications are to accelerate abortion. That abortion may be inevitable or missed abortion. And next is to stop bleeding following evacuation of the uterus. Next, to induce labor. Next, AMTSL. AMTSL means active management of third stage of labor. Next, to minimize blood loss and to control PPH. PPH means postpartum hemorrhage. So here in active management of third stage of labor, before starting to manage the third stage of labor, we have to rule out the presence of another baby by palpating the abdomen and trying to feel for fetal parts. Next step is we have to administer uterotonic drugs. That is, we have to administer 10 international unit of injection oxytocin as an intramuscular injection to the mother if she is at a health facility, or we have to give misoprostol tablet, that is 600 microgram orally. 3 tablets. In 1 tablet there contains 200 microgram if she is at home delivery. Next step is we have to do control cord traction, that is in short CCT. So in CCT what we have to do, we have to clamp the maternal end of the umbilical cord close to the perineum with an artery clamp. After that, hold the clamp and with one hand and place the other hand just above the symphysis pubis for counter traction. After that, maintain tension on the cord and wait for a contraction. During a contraction, gently pull the cord downwards to deliver the placenta. After that, with the other hand, push the uterus upwards by applying counter traction. If the placenta does not descend within 30 to 40 seconds of CCT, then do not continue to pull the cord. Wait for about 5 more minutes for the uterus to contract strongly, then only repeat the CCT with counter traction. As the placenta delivers, we have to hold it with both hands to prevent tearing of the membranes. After that, gently twist the membranes so that they are expelled intact. After delivering the placenta, place it on a tray. After that, we have to do what? We have to do uterine massage. Okay? So, here, how we are going to control the intravenous infusion. So, this injection oxytocin, it is started at a low dose rate, that is 1 to 2 milliunits per minute, and increase gradually. Initial infusion rate should be set at 2 to 8 drops, that is 1 to 4 milliunits per unit. Not per unit, per minute. 1 to 4 milliunits per minute. Here side effects are hyperstimulation, rupture of uterus, amniotic fluid embolism, fetal distress, fluid retention if used high doses. Next, contraindications. Here contraindications are if the mother is grand multipara, if there is obstructed labor, if the mother is cardiac patient, and if there is previous history of anaphylactic shock. In that condition, we cannot administer this injection oxytocin. Next is injection metharzine. It is highly effective in homeostasis to stop bleeding from the uterine sinuses, either following delivery or abortion. And this metharzine is somewhat slower in the producing uterine response, taking 96 seconds in contrast to 55 seconds by argometrin when administered intravenously. So here mode of action is argometrin acts directly on the myometrium. It excites uterine contractions which come so frequently one after another with increasing intensity that the uterus passes into a state of spasm without any relaxation in between. Here mechanism of action. It causes powerful titanic contraction of both upper and lower uterine segments. Indications are prophylaxis and treatment of atonic postpartum hemorrhage, 0.2 mg IM or IV. IM means intramuscularly, IV means intravenously after delivery of placenta. Next, first trimester MTP. MTP means medical termination of pregnancy. In that condition also we can give this injection methargine. Next is following LSCS, lower segment cesarean section or hysterectomy. In that condition we can give this injection methargine. So side effects are there may be nausea, vomiting, transient hypertension, chest pain due to acute coronary spasm. Contraindications are before birth of soldier, before second twin is born, heart disease in pregnancy, PIH means pregnancy induced hypertension, or if there is chronic hypertension, if the mother is Rh negative, if there is vascular disease. In this condition we cannot administer this injection methargine. Next is prostaglandins. This prostaglandins, it is available in forms of dinoproston, which is also known as prostin E2, misoprostol, that is PGE1, primiprost, that is PGE2. All these are oral tablets. Here mechanism of action. Prostaglandins increase intramyometrial calcium concentration and enhance uterine contraction. Here indications are induction of abortion, that is MTP and missed abortion. MTP means medical termination of pregnancy. Next is termination of molar pregnancy. Next, induction of labor. Next, cervical ripening prior to induction of abortion or labor. Next is acceleration of labor. Next, management of atonic PPH, that is postpartum hemorrhage. Next is medical management of tubal ectopic pregnancy. And now let me talk about route of administration, that is vaginal route. In vaginal route we have to give vaginal tablet, that is 3 mg dinoproston, prostin E2 in the posterior fornix, followed by 3 mg after 6 to 8 hours, maximum 6 mg. Next tablet is tablet misoprostol, that is 200 microgram per tablet. We can give 600 microgram, that is 3 tabs, to prevent postpartum hemorrhage and also if there is excessive bleeding after delivery. Next is side effects. In the side effects there may be nausea, vomiting, tachycardia, cervical laceration, etc. Next, let me talk about contraindications. Contraindications are hypersensitivity to the compound, if there is uterine scar, if there is active cardiac, pulmonary, renal or hepatic disease, and also hypotension, and at last if there is bronchial asthma. These are the contraindications of administering prostaglandins. Next is magnesium sulfate, which is very important drug in the prevention of eclampsia and preeclampsia and also in the prevention of preterm labor. So indications, these are only prevention and treatment of seizure in preeclampsia and severe preeclampsia. Route of administration and dose, there include loading dose, that is 4 to 6 gram IV infusion over 5 to 10 minutes plus 8 to 10 gram IM. Maintenance dose is continued using 4 to 5 gram IM every 4 hours in alternate buttock for 24 hours after the last seizure. Then subsequent dose should be given after monitoring hourly the clinical signs of hypermagnesemia, urine output at least 30 ml per hour, respiratory rate at least 16 beats per minute, reflexes should be there, knee jerk must be present. Okay. Next is diazepam. It may be injection or tablet. So uses are status epileptics, eclampsia, pregnancy-induced hypertension, preoperative medications for operation like DNC, that is dilatation and curettage, MTP, medical termination of pregnancy and laparoscopy, etc. Actions, it is a sedative, hypnotic and anticonvulsant agent. Routes of administration, it may be oral, IM or IV. Dose, in status epilepticus, we have to give IV 5 to 10 mg over 2 to 4 minutes. Repeated every 10 minutes if required. Respiration should be watched carefully. The anticonvulsant action lasts for 15 to 20 minutes only. In condition pregnancy-induced hypertension, that is PIH, it may be mild, moderate cases. We have to give 10 mg every 6 to 8 hours. In case of eclampsia, we have to give 10 to 20 mg IM or IV repeated every 4 to 6 hours or 40 mg IV followed by IV injection at a rate of 10 mg per hour for 24 hours after delivery. Side effects are for the mother. There are respiratory depression, bradycardia, hypotension, shock, paradoxical hyperexcitability. In this condition, patient may become rowdy. Toxic reactions like ataxia, vertigo, and shine cough. In case of fetus, the side effects are it crosses the placental barrier, respiratory depression, hypotension, impaired temperature regulation, hyperbilirubinemia, poor suckling, neonatal withdrawal syndrome, tetragenicity increase, that is 3 to 4 times incidence of cleft palate and cleft lip. So these are all about diasperm.